Please help me welcome to the stage our speakers and moderator for our next panel, The Universality of Aging, Developing Policy Today to Impact Everyone's Tomorrow. Ishan Williams, professor at the University of Virginia. Ames Simmons, senior fellow at Duke University School of Law. Mattia Gilmartin, chief of staff at NYU Meyers. Kari Benson, Deputy Assistant Secretary for Aging at Administration for Community Living, Administration on Aging. The panel will be moderated by Melissa Batchelor, who is a tenured professor and director of the Center for Aging at the George Washington University School of Nursing. She also currently serves on the Academy's Equity, Diversity, and Inclusivity Committee and the expert panel on aging. Please welcome our panelists and Dr. Batchelor to the stage.
Good afternoon, everyone. I'm Dr. Melissa Batchelor, and I am a professor at the George Washington University School of Nursing and director for our Center for Aging, Health, and Humanities, and also host a weekly podcast called This is Getting Old, Moving Towards an Age-Friendly World. I'm joined today by Kari Benson, Dr. Mattia Gilmartin, Ames Simmons, and Dr. Ishan Williams. Okay. And this is the first interactive panel of the conference, University of Aging, Developing Policy Today to Impact Everyone's Tomorrow. So throughout the conversation today, we would like for you to submit questions, comments using the app in the conference app. You just click the Q&A button and type in your question, and then I'll be able to ask that of the panel at the end of our discussion today. So healthy aging begins at birth, and it involves individual decisions and the support of our communities across the lifespan to age well. When we talk about the universality of aging, I want to be clear that we're not just talking about today's older adults. Because anytime I talk about aging, most people assume that I'm talking about the baby boomers because they are historically have been the largest generation, but they're actually the youngest of today's older adults. What may surprise you, though, is that 5 years ago, the millennials took over as the largest generation, and about 3 years ago, they started turning 40, which makes them old enough to sue for age discrimination in the workplace. So, anyone in here born before 1996? Okay. Well, if you were, you're part of this conversation today, plus the generations behind you. Because we only have 23 more years to get prepared to get the policies in place to help the millennials that today's older adults already need. So before we get started, let me briefly introduce our speakers. Their full bios are in the conference app. So first we have Dr. Ishan Williams. She's a tenured professor at the University of Virginia School of Nursing. She has a background in human development and family studies. Ishan focuses her research on improving health of older adults and caregivers by understanding their healthcare needs within social, cultural, and geographical context. Next, we have Ames Simmons, and he is a senior fellow at Duke University School of Law, an adjunct professor at the George Washington University Columbian College of Arts and Sciences, and a policy consultant. Ames teaches, consults, and advocates for the LGBTQ equality in the realms of health law and policy, and previously spent 17 years providing in-house legal and regulatory services related to Medicaid and HIPAA. Dr. Mattia Gilmartin is the Chief of Staff at New York University Roy Meyers College of Nursing, and from 2016 to 2024, she was the Executive Director for the Nurses Improving Care for Health Systems Elders Program, or NICH, at NYU Meyers. So in this role, she led a 500-member organization whose mission was to create age-friendly health care services for 48 million older adults in the United States. Kari Benson is the Deputy Assistant Secretary for Aging at the Administration for Community Living, Administration on Aging. There's a lot of administrations in there. Yes. So in this capacity, she guides and promotes the development of home and community-based services, policies, and services designed to afford older adults and their caregivers the ability to age with dignity and independence and to have a broad array of options available for an enhanced quality of life. So just a reminder that throughout the conversation, please submit your comments and questions in the app so that we have some. All right, so now that the introductions are done, let's dive into the questions. So the first question is for Ishan. So we've heard in sessions so far that community and connectedness are associated with improved health outcomes. So how, in your work, do community-based strategies improve care at home for diverse, underserved populations?
Thank you. Again, thank you for the invitation to be here. I think I'll start by just saying, if you read the bio or you listened just now about the work that I do in community-based services, is mostly around older adults living with Alzheimer's disease and dementia. And often there are just not enough specialist providers to give families the diagnoses that they need to understand how to live and manage the disease at home. So really taking the evidence that we have in research out into community-based services or into community organizations where they are actually working with families to actually help them learn how to live and cope with the disease. Often I live in the state of Virginia, and there's a huge capacity resources that are just not enough specialist providers that are around to get people seen, to get those diagnoses. So oftentimes our aging support services are the people that our families are turning to, and those are the ones who are actually trying to help families manage and find resources to continue to live in their home setting versus a long-term care facility. And so when we look at that, we know that there's still a clear a need for coordinated care to not only work with community-based services, but to work in connection with our clinic services, because again, if people aren't being seen in clinical settings and they're sharing their needs with their community-based supports, that's where we really need to bridge the gap. And so a lot of times, at least in the state of Virginia, and I know in a lot of other states, we have area agencies on aging, which really is that bridging of the gap for families. That might be the first hub that they go to try to identify what other community-based supports are in place so that they can continue to remain at home. But these AAA services, the AAAs in each community, need to be culturally relevant, they need to be inclusive, and they need to really provide programming that meets the needs of their immediate community. And how do we learn and hear about what that is besides listening to the stories of people who live in those communities? I can't tell you the number of stories that I hear from families about they want to see their doctor or they want to get into the clinic, but really they can't, and they have to really figure out what to do. They may not even have a diagnosis. I think in Virginia, I think it's like 1 in 10 people, about 300,000 Virginians, actually have noted to their doctor that they have some memory cognitive decline, but they haven't been able to get in to see a practitioner. And also about, I think I wrote the stat down because I knew I would forget it, about 25% of those families say that they actually need assistance, but they haven't even actually talked to their doctor or even been told what they need to do with the next step. So I think what the work that I do in community is going out into those settings, taking the research that we do either within those communities to find out what those immediate needs are and how do we bridge those gaps with the clinical setting, because we need to get the clinic out into the community, and those services will be able to help families more.
All right, thank you. So this next one is for Ames. What does having the right to age look like in the trans community?
Thank you, Melissa. Honestly, the right to age looks the same for transgender and non-binary people, I think, as it does for all people. It includes the services and supports that we all need in order to be healthy and well as we age. From a policy perspective, trans people's rights to healthy aging are supported by the recognition of gender identity as a factor in social isolation, causing the greatest social need under the Older Americans Act, for which we are grateful to the administration. It also means inclusion in state LGBTQ long-term care bills of rights, such as one that just recently passed in Massachusetts this year. There are about 171,000 transgender people who are age 65 and up in the US, and that is definitely an undercount because a lot of folks don't feel safe about being open about their identity. This is important, especially for this audience, because 1 in 2 trans people and 68% of trans people of color have reported some type of discrimination or mistreatment from a provider. So this could be misgendering, like calling a transgender woman sir, for example. It can include ridicule of a trans patient. It includes substandard care, delayed care, and sometimes a denial of care altogether. Even among providers, in one study, 1 in 5 palliative care providers said that they had actually observed such discrimination against trans and non-binary people. And that's important because trans people know about those statistics too. Trans people report a lot of fear of being mistreated in long-term care. I mean, maybe everybody does, right? I mean, I think a lot of folks have anxiety, but for trans people, it can look a little different because trans people are fearful that our gender identity will not be affirmed in long-term care, afraid that our transness might be seen as a symptom of psychosis or dementia, afraid that age or dementia might result in a termination of the gender-affirming care that we need. But we know that most of us at some point are going to need long-term care. The last statistic that I saw was like, for the average person, it's 65 to 70% likely that you'll need long-term care. And there are new tools like the Long-Term Care Equality Index that can assist trans and non-binary people to find supportive care in their communities. The LEI, the Long-Term Care Equality Index, is a project of SAGE and the Human Rights Campaign Foundation, and it serves 2 purposes. First, and to my mind primary, it's designed to assess a senior housing community's current services so that trans and non-binary people know where to find long-term care facilities in their area that have affirming policies. We still need more folks to enroll in the LEI, though. The second, the Long-Term Care Equality Index actually assists those facilities in adopting these policies and procedures that promote culturally competent care, like Ishan just mentioned. Those can include confidentiality protections from outing and access to the care that transgender and non-binary people need. Many of these criteria, by the way, also support compliance with the state long-term care bills of rights that I mentioned earlier. So good policy helps trans and non-binary people see a future for themselves that includes healthy aging.
Okay, thank you so much, Ames. This next one is for Mattia. What considerations are there in integrating community-based and inclusive care strategies at the micro, meso, and macro levels? I didn't write these questions, and they all proved them, so.
So the good news is there's a social movement afoot to promote age-friendly care, age-friendly society, this celebration of aging, and a movement to design society for demographic changes. At the capital P, so by that I mean legislation, regulation, and appropriation, there's 4 key considerations at the macro level. So first is workforce. In the healthcare space, we know, unfortunately, that clinicians are falling further behind in having the knowledge and skills that they need to effectively care for older adults when they come into service. Although the competencies are well defined, there's still large skills gaps. This extends to the workforce in general. So in all sectors, workers need skills to effectively engage with older adults, particularly those that have cognitive decline, so places like grocery stores or retail spaces, et cetera. So there is competency that the workforce needs. We clearly need a new type of workforce, so there's interesting emerging roles to fill into these spaces, particularly if we're trying to move to community or home-based services. But that workforce needs Clear career path. They need to be paid appropriately for their work. People need to see, so new career entrants, so our high schoolers and our middle schoolers need to see aging as a fruitful career path. Also, I would tie to workforce the need for more research around, what works, what are the competencies, how are we going to get the competencies part of everyday life. The second factor is payment models and financing. So we clearly need payment reform. We need socially responsible investment, so investments that bring returns to society. For example, we have Medicare Advantage programs. So that's the privatization of Medicare. They've been coming under fire recently because they're essentially rationing care and not delivering the same level of quality of care as the fee-for-service Medicare program. So in payment, we need payment models that support quality and safety, but also give organizations a financially viable model to deliver the services. Next, we have regulation and policy. So everything needs to be aligned from the federal, the state, the local level. Sometimes the regulations and policies interact. Recently, we're seeing sort of realignment of regulations, particularly for the dual eligibles. So these are the Medicare beneficiaries that are also, they're poor and they have high needs. So they have Medicare for the federal program and Medicaid for the state program. But oftentimes the regulations and the service packages conflict with each other. So we need, alignment and sort of right sizing of all of that. And then finally, the big sort of trend that's moving into the sector is technology. So the digital age is here, and we want older adults to use electronic health records and apps and all these things that they may not find acceptable. They might not have the skills. You need broadband, you need the computer and iPad. So there's lots of, it's the technology, it's the design of the software, it's the access, it's the burden, privacy, et cetera. At the meso level, I think this is the interesting part. This is where all the organizations are. This is where the action is. So at this level, we need to look at how the organizations are aligned, how they're bringing on strategic goals and investing in age-friendly, aging-in-place services. So that's their strategic goals, alliances, investments in contracts and referral pathways. This is also where we need more emphasis or support for the consistent use of evidence-based practices. So there's many geriatric care models out there that work. They tend to be interdisciplinary. Many are nurse-led or managed, but they aren't really used in everyday practice. And then finally, we have at the micro level, that's the older adults, their families in general, healthcare providers, that point of service delivery. I think here, to your point, Melissa, we have to start younger, so we need to get to a place of health longevity and healthy aging. So we're working with younger people to help reduce the burden of chronic illness. So as you age, you have less chronic illness, you're living healthier, and then as people go through the lifespan, we're helping to honor their wishes and help, at the end of life, have the quote-unquote good death.
Okay, thank you. So Kari, with your transition from working at the state level in Minnesota to the federal government, how has your experience working with rural populations, tribal nations, and disability organizations influenced your ability to influence your approach at the national level? And what can these communities teach us about what inclusive, healthy aging looks like on a larger scale?
Thanks, Melissa, and thank you for having me on the panel with you all today. This is just an absolute joy, and I am very excited for this conversation because I feel in and of itself it is answering that question. What brings me to the work and what I've learned working at the local level, regional, and state level in Minnesota for many years. I always say I've grown up in the Aging Services Network, love the shout out to the Area Agency on Aging and our Home and Community-Based Services Network. And now at the federal level, get to oversee the network and push for policy change. And what that work has ingrained in me is a deep appreciation for and respect for the work at the local level, where I always think about this saying, you know, think globally, act locally, and it is so true, and it's so true, and as you were talking, Mattia, too, through your response about the different levels and the need for alignment, what really matters to each of us as we age is our daily life, right? Our interactions. How do the systems that I touch, that I interact with, how do they work for me? How don't they work for me? Are they relevant to me and my culture? And so as I worked alongside tribal communities in Minnesota, as I worked in rural areas, as I worked with many diverse communities, I really learned so much from them about what it means to have a community and that supports all of us to age well and live well throughout our lives, not just when we're older, whatever that is defined as, right? So for me then, I take that to the federal level and am really looking for partners such as the Academy and others to really partner on the federal level, national level, policies, programs, investments that we need to support the community level programs that really do make a difference. It goes directly to the integration of the healthcare and social services that to really braid together the supports that any one of us might need as we age. And it means that we really need to work together and work very diligently to realize the vision in the Older Americans Act, which governs the use of course, the Older Americans Act funds and the Aging Services Network, but really realize that vision of meeting the needs of those in greatest social and greatest economic need, to develop a coordinated and comprehensive system of services for older adults, and as a way of doing that, supporting their family members, right? We know that the bulk of in-home, long-term care, long-term services and supports is provided by family caregivers. And so that's another way too, where we need to keep that in mind. We need to hear directly from families, we need to hear directly from older adults, and we need to use that to drive the policies and practices that we put in place at the federal level, and that really sets the stage then, right, for what's most important, which is that person level, those direct interactions that each of us have on a daily basis. For me, it really comes down to being person-centered and community-centered. Again, to think globally about what that means for each and every one of us, and really take everybody as they come. You know, as you show up to a clinic, as you show up to the hospital, as you show up to a congregate meal site or need a ride to the doctor, and really with an eye towards how do we set up our systems for success in taking a very person-centered and community-centered approach.
Okay, so thank you all for those very thought-provoking responses. We're now going to transition into talking more from a federal and state policy perspective and the role of nursing. Today is Halloween, and one of the most feared diseases by Americans is the fear of developing Alzheimer's disease compared to other diseases, when in fact Alzheimer's disease kills less people. You'll either die with this disease or you'll die from it. So back down to Ishan. Your current research is focused on the utilization of recruitment science to raise awareness about increased accessibility to those who are most at risk for developing Alzheimer's disease and related disorders. So what does your work tell us about what it's going to take to prepare the population for healthy aging, both in terms of Alzheimer's disease and more broadly, the role that nursing plays?
Sure. So I kind of want to piggyback on those last comments because I think we alluded to this earlier. I love the title of this panel, The Universality of Aging. But one thing one thing we're all doing right now is aging together, but we're not all doing it the same way. We won't all reach healthy aging, or some of us may not even make it to live a certain age. So I think really thinking about those structural and social and environmental determinants of health that is sort of embedded in each of our comments today, I think is critical. And so that is something that I bring into my research. And so when we think about sort of doing research with underrepresented populations or unreached populations in Alzheimer's disease, they're 2 to 3 times more likely to have Alzheimer's disease. And so when you look at clinical trial data and you notice that less than 1% of those populations are even represented in those trials, you start to think like, is this going to really affect and really reduce the disparities that we're seeing in some of these populations who are clearly suffering from a disproportionate burden of the disease? And again, we've talked about, sort of the lack of capacity to see families who live with this disease. And so think about these, these other isms that they're also living with. So I'm thinking intersectionality, the multiple things that people are having to manage, not only their chronic conditions, what if there are multiple chronic conditions? So it's Alzheimer's disease and high blood pressure and something else. So when you think about sort of the multiple chronic conditions, the multiple barriers, structural or environmental, and of course social barriers that people have to even access care, we see that there's a huge need and emphasis on trying to do a better job. And how do we do that? I think it's been increasingly over the last few years where we've heard many more conversations about the need to do this for improved strength of our clinical trials, as well as the generalizability of what our trials can do. But also as, I'm a social scientist, but I work with lots of nurses. And so, but in healthcare, one of the things that I promote is a lot of nurse-led interventions and nurse-led healthcare implementation science around where nurses can actually still advocate for research and clinical trials that focus on inclusive methods. So we got to get out of the ivory tower. We got to go into the community. Getting a clinical sample often is not going to look like those who are in the community who cannot access that clinic. So making sure to advocate for inclusive methods that are meant to benefit all older adults, such as developing these drugs or devices that can be used more broadly across adults, older adults, especially when we're talking about populations that suffer disproportionately. And I also had, think globally, act locally. We all have the opportunity to, at your state level, politics is where decisions happen and where a lot of change can happen that then feed into the federal policies. And as an academic, I think one thing that I often strive to do with my students is I try to make sure that they focus on education, service, as well as research. And so I advocate highly for continuing to focus on a diversity of our workforce, the sustainability of our nursing workforce, and on the content of what's being taught. So really pushing our accrediting bodies, to really focus on these inclusive methods and equity across all of these content areas so that we can move the policies forward.
Thank you. So if you came in a little bit late, just wanted to remind you that if you have a comment or would like to ask a question, just open your conference app and go to the Q&A button. You do have to put your full name in, but we don't see it and you won't see it. So if you're being shy, you can ask a question. Someone's already asked a question. I see it here. I don't even know who it is, so you can do this anonymously, but someone will know who you are. I guess probably just to make sure you behave, right? All right. So Ames, what does gender dysphoria? How does gender dysphoria impact aging, and how can nursing and other professions support gender-affirming long-term care?
So one thing to note is that not all trans and non-binary people experience gender dysphoria. My gender dysphoria looks different from a lot of other people in trans and non-binary communities. But in particular, the healthcare discrimination that I mentioned earlier can make dysphoria worse. And we know that older adults who have experienced discrimination, like I talked about before, are more likely to report like poor or fair memory. To just pick up the thread of talking about Alzheimer's disease and related dementias. Other research shows that the prevalence of risk factors for Alzheimer's disease is 2 to 3 times higher for transgender people. This is all really recent research, and that trans people are significantly more likely to report subjective cognitive changes compared to cisgender or non-transgender people. Experiences with healthcare discrimination in the past may cause trans people to fear more discrimination in the future in long-term care, especially if we can't self-advocate in ways that are understood by our care team. And these are all issues that I think nurses are really well positioned to deal with. For example, nurses can research trans health disparities related to dementia. My colleague Ethan Cicero, who I think might be at this conference, has published really important emerging findings that cognitive changes are reported more often for transgender people of color than even for white transgender people. We do not have a lot of research to help us understand whether or how cognitive changes might affect a person's understanding of their gender identity. And nurse-led research can help to fill those gaps. And then I also want to mention that nurses can help transgender and non-binary people work through advanced care planning to help mitigate some of those fears and anxieties. I have another colleague, Lauren Catlett, who's at UVA, is working on how advanced care planning can help trans and non-binary people. So not a lot of trans and non-binary people have advance directives, so we're not different from the general population in that way. But research among racial and ethnically minoritized older transgender adults indicates that there's strong support, there's strong interest in completing advance directives. I worked with Transgender Law Center and with SAGE on a resource called Planning for Lifelong Care that can help guide trans and non-binary people through these kinds of questions. And even possibly I've drafted language that may be able to be used in an advance directive and in healthcare powers of attorney to help provide guidance to the people who are caring for trans and non-binary folks about how they want to be treated. The key takeaways here are that advanced planning care is a planning tool that will likely come into place sooner than end of life for many people. And it's especially important for trans and non-binary people who have thin social networks and might need extra time to intentionally develop those relationships. And finally, we need to start thinking earlier in our life cycle about advanced care planning and revisit that periodically as our circumstances change. And I think that's true for everyone.
Yes, and if you'd like to learn more about a lot of what he's talked about, he has been on my podcast before, and we've had 2 episodes, so you can have a little bit deeper dive if you want to check those out, and I'll tweet those out after our session later today. So Mattia, we have about 18 minutes left down there, so in about 4 minutes. That way you have 4, and we have time for a question or 2. What are the greatest system-level barriers to widespread quality care for older adults, and what is nursing's role in creating these systems?
Great. Well, first, we don't really have a system. We have lots of fragmentation. So I think if the extent to which people can use a holistic view or a wide lens view to really understand how the different sectors either move together or not, but the goal is to get everyone moving in the same direction around this goal of, healthy aging, aging in place, aging in community. So I think nurses have a great role to play. First, as clinicians and partners with people to help them on their healthy aging journey. So like I talked before, healthy aging, reduce the burden of chronic illness, better chronic disease management, and then as people are entering the end of life, what can we do to support what matters most for older adults? For those of you, like I said before, all the action is at the organizational level. So for the leaders and managers and innovators and entrepreneurs, there's a lot going on. So can you advocate for strategic goals and, the organization moving into these spaces, the investment, the, assessment of quality and safety? So nurses can really be influential in this space. And then I think the last piece that nurses can do is the larger lens around policy advocacy and technical assistance, and at all levels. In your organization, at your county commission, state, federal, there's lots of places that you can plug in. People like Kari, I think, would be happy to have expert nurses come and work with them and share their views and help really, shape policy advocacy pieces of legislation. I think with aging, so, with this idea of social change is going on, there's many places that you can read about or sort of get up to speed on this big picture. So for example, Kari's group has sent a wonderful report to Congress on the state plans for aging. So their master framework for aging tells you everything you want to know about what America needs to do to move in this direction. Places like Commonwealth Fund, Kaiser Foundation, track all the different strands. So get involved, do what nurses do best, help people live their best lives.
Okay, and so Kari, after everything that we've discussed so far today, how do all of these things align with the national priorities on aging? What progress has been made? What progress does the administration hope to make? And then what is nursing's role in all of this?
Well, I love this. This is perfect, especially building off, Mattia, what you were just talking about. This is exactly the kind of conversation we need to be having, and we need to have more of these, right, to inform federal level policy and programs. And of course, a lot of what is in place or maybe not in place or not coordinated also, those decisions also do occur at the state level. But I am really excited to be a part of an effort to develop a national plan on aging. It would be our country's first plan on aging, and why I'm so excited is because we are seeing growing momentum to have a different kind of a conversation about aging, because, as I think, Ishan, you said, we're all aging, and aging is not the problem, ageism is the problem. And so we need to really come together and seize this opportunity where the Administration on Aging, ACL, we were authorized by Congress, directed by Congress. This time we were happy about it. I hope there's no staffers here. But so this time we were happy about it. We were authorized to convene federal agencies to develop a strategic framework for a national plan on aging. So we released that earlier this year to Congress, and very much informed by the multi-sector plans on aging at the state level. So we released that. It was really developed as a first draft by our federal agency partners. Now there's 18 agencies working together, and we actually want to work on this together, and we're excited about it, which shows you there's something to this. There's something different about what we're doing. And we see that there's potential, right? So now we've got the framework out. We need your input. You all, as nurses in the field, and interacting daily, providing care to older adults and their families, as well as the rest of us too, you are the ones who really know, right? What's working, what's not, what do we need to do to push forward our healthcare and social services and all other systems to really develop communities and create a future for all of us as we age. And so I really strongly encourage you all, please, to provide input on that framework. So if you just Google strategic framework for National Plan on Aging, we can't come up with any short titles for these things. But age-friendly, National Plan on Aging, but you can find it. We're still gathering the input, and it's a direct line into the work that we're doing, and stay on top of it, track that, really help us build that momentum. We have to get it beyond a federal agency or federal government kind of effort, because it really does need to be about all of us, right? To get some traction behind it, hopefully feed into a White House conference on aging next year, and really set in place, again, like I said, that plan that we can all be a part of shaping.
Okay. And if any of the terms that Kari mentioned are new to you, the 2024 Age-Friendly Ecosystem Summit is an event that the George Washington University Center for Aging puts on. So if you type in GW Center for Aging, on October 8th, our entire first day was dedicated to these multi-sector plans, the National Plan on Aging, and how this also ties in with age-friendly initiatives. We had speakers from ACL, AARP, grant makers in aging, so you can check that out there. And I only want to make one more comment about ageism. Yes. In case you did not know this, what you think about aging actually matters. It impacts your health, and if you have, there's already ageism in the world. We see it primarily in birthday cards and, lots of different places, marketing and sales. But if you have self-imposed negative thoughts about aging, you can actually decrease your lifespan on average by about 7.5 years. So let's all not be ageist, be like my children who can recognize it. They're like, Mom, that was so ageist. And I'm like, I love it, you're like 12. Got it. All right, so now we have about 11 minutes to answer our questions. So the first question, and I'll just open it up to the panel, so just raise your hand and jump in. What type of policy changes can we help to create to support an aging in place and empowering caregivers to remain employed or reimbursed for caregiving?
I'm waiting to hear from all of you.
Well, I think
It's almost
if
like
we
two different questions.
very narrowly, this idea of going from your house, you have an illness episode, you go to the hospital. Right now, the direction of travel is you automatically go to the nursing home. In the United States, 30% of older adults living in nursing homes used to live at home, and they get stuck there because there isn't a pathway for them to go home. But it's complicated. It goes back to this sort of wide angle, and all the components have to be moving together. There needs to be adequate payment for that. There needs to be referral networks. There needs to be actual services in the community. There needs to be really tight coordination, so as people are moving from levels of care, there's skilled clinicians, workers, whatever you would like to call them, that are following the older adult and the family to supporting them. So some places have this. So there are models that work, but the problem is that they exist in very limited context, and scaling them is the difficult part, because it goes back to workforce payment, policy regulation, and the interaction of the organizations. So I know that's sort of doom and gloom. I don't know it's all these pieces together that have to be lined up. So when you read the policy work, they call it rebalancing. Actually, there's a great new piece in Health Affairs by a team at UPenn Law in this idea of long-term services and supports. And they showed the complexity of all the current laws and regulations that are essentially barriers to getting to long-term services and supports.
Okay, I think you thoroughly
Yes.
got that one. So we have some more. So Ames, you mentioned SAGE. Can you tell us a little bit more about this resource for people that haven't heard of it before?
Oh, sure. So SAGE stands for Services and Advocacy for LGBTQ Elders. And the resource that we worked on is actually in the National Resource Center on LGBTQ+ aging, which is a joint project between SAGE and the Administration for Community Living. So it is part of a suite of resources around advanced care planning. There's a much bigger LGBTQ guide to advanced care planning, and there's also some really good resources, Nursing Friends, about person-centered trauma-informed care for transgender older adults that I think is a really good resource.
Okay, thank you. All right, so this might be for more Ishan and Kari, but do you have any suggestions on how to best support patients and families to access community resources to enable patients to stay in their homes longer versus long-term care placement at the time of discharge from any acute care setting?
I'll start. And I think Tia actually mentioned it. It really does depend on where you live. I mean, the resources, and so I'll shout out our AAAs again in your local area. Like that probably is going to be the best place to start. But one of the things that we're doing in the state of Virginia is we're trying to build capacity with our community health workers across the state who work in our health departments and who also are going to be partnering in some of our aging support services, service organizations, to really train them in how to help support coordinated care programming at the community level. So earlier I said in my comments about we need good clinical care coordination as well as community coordinated care. So working together with sort of understanding the resources in your local area is one of those real benefits of helping families and their care partners keep the loved one who's living with the disease in the home longer than going to an assisted or a long-term care facility. There are just a lot of these structural barriers to sort of income, like the work, like how to pay for some of these services, which is where it gets complicated. And those are the heartbreaking stories that you hear from families, because they may have their first home and it's a generational wealth thing for them, and then they're being told by their aging support service, in all good intent, you have to sell down, you have to sell your home, you have to, become, Medicaid eligible to be even able to pay for some of the services that you can be eligible for. And that's not the system that any of us want to live in. That's not what any of us work hard for, to get to a place where we feel like we have to reduce down and think about longevity or think about heritage there. But or inheritance. So I think that the complications are vast, but we wanted to leave a positive spin on saying that, building up a workforce that understands sort of these barriers and these challenges for families really helps our community organizations find, like either working with faith-based organizations or other types of respite programs. If you know your community, which is why we need to get in our communities, but if you know the needs of your communities, there are a myriad of ways that we can try to support and offset and try to balance some of those needs before, and that does help people stay in their homes a lot longer than necessary. But there is ultimately, there are options for long-term services as well when that is needed, but most people, want to stay in their homes.
Okay. And then this question is going to be for you, Kari. As the population continues to age and needs continue to grow, do you have any concerns about funding for the Older Americans Act? And then what could the collective we do to advocate?
Well, we're not currently meeting the need that exists, right, for home and community-based services, especially for services that if any one of us would need it as we age, we want to receive it at home, right? So right now there's not enough funding if we're thinking it's going to be public funding. And so I would say yes, there's a concern right now, and there's a concern going forward. There's a need for all of us to speak to the need that you see in your communities, and through the work that you all do, every day you see this, right? The need for services, especially those services that are culturally appropriate for any given individual and their family. So we need to collectively be advocating for that, sharing your stories, sharing your experience from the local level, from your direct work experience with members of Congress, with organizations that also can be advocating for this funding. But what we also need to do, and it has been a big focus so far in our work towards a national plan on aging, is towards other financing options as well, right? So that there could be mechanisms in place for us all to be able to buy into, to be able to pay for our long-term services and supports needs as we age. And so there's very much a need for that. There's very much a need for a range of price points that we can all access so that we can have a system of long-term services and supports that supports all of us. So I think that's also a key component of it.
Okay. Well, thank you. And I think it's not just the federal and state governments, it's not just their responsibility, and that's really the whole point of having a multi-sector plan on aging is it's going to require businesses, but also volunteer organizations, nonprofits. Collectively, we're going to have to come together to solve the needs of the community that you live in, because if you've been to one place, you've been to one place. So we have about 2 minutes left, so someone can answer this in 1 minute or less. And I'm going to reframe the question a little bit. What advice would you give to every generation of nurses regarding aging and policy? And if you don't have an answer, I do. You go ahead.
It's everyone's business. It's core to what the workforce needs to be doing. And I also think we need more research, interventions, implementation, and then the analysis of policy. And is the policy that we have, is it getting us the outcomes that we think it should?
Do you have anybody else have anything to add?
I would just say, maybe building on the ageism remarks, I would say learn about ageism and learn how it is affecting how you see the work that you do, and learn how to start reframing aging for yourself personally, your family, your community, and then the work that you do.
Yeah, there actually is now a national center for reframing aging. So definitely check out their website. They have a ton of resources because there's one thing about aging, everybody's doing it. In fact, you're all now officially 50, almost an hour older than you were when you got here. So we'd like to thank the panel for being here. I'd like to thank all of you for joining us today, and I hope that you have a wonderful rest of the conference.